Carpal tunnel syndrome, CTS, by Veronica Reimer. In 1854, Sir James Paget had his first patient who was a male, with pain and impaired sensation in the hand from trauma of cord drawn tightly around the wrist. Your life with carpal tunnel syndrome won't change as much, since there are many treatments options aimed to reduce compression of median nerve so you can do your daily tasks. However, you may have to take many breaks throughout your daily tasks. CTS is very common in US. About 3 million people have CTS. CTS affects both of your hands. It is 3 times likely for women to get it than men, ages between 30 to 60 years old. So this is your median nerve and this is your carpal tunnel. If you cut your wrist in half, you will see this little diagram. This is called body arc, which holds up 9 tendon flexors, which are the nerves that goes into your fingers, and this is a sheath of a connective tissue, flexor reticulum. It's a palmar side of your hand, and we have one median nerve. Whenever the carpal tunnel compresses, it pressures the median nerve and gives pain in areas such as half of your ring finger close to your thumb, your middle finger, your index finger, and of course your thumb. It gives pain such as numbness, tingling, and eventually sharp pain like needles that is called paresthesia. This extends to the forearm. Causes include repeated movements with your hand and arm, repeated use of vibrating hand tools, pregnancy because hormonal changes during pregnancy can cause swelling, diabetes, and thyroid gland imbalance are conditions that are linked to carpal tunnel syndrome. Trauma such as dislocation or fracture of the wrist, structural problems in the wrist joint, and overreactive pituitary gland, many kind of swelling or inflammation around the tendons. So, who is at risk? Farmers, and specifically those milking cows, factory farms or mechanical workers who wear tight gloves and use their hands a lot, gardeners weeding by hand, mechanics using screwdrivers and pushing down ratchets, musicians using a bow for stringed instruments, office workers, meat processing workers who are deboning and cutting, stable hands, painters, and carpenters who press tools into the palms. How does CTS get diagnosed? Your doctor will do some tests on you, like tunnel test. Your doctor will also tell inside the wrist median nerve to see if it causes tingling in the fingers. This will cause feeling of an electric shock. Second, Phelan test. The doctor will have to press the back of your hands together for a minute to see if this causes numbness or tingling. And third, your doctor may order nerve conduction test or electromyography EMG test. These tests used to see whether nerves and muscles in your arm and hand show typical effects of carpal tunnel syndrome. Treatment is determined by your age and medical history, what is the condition of your wrist, which specific medications, procedures, or therapies would not cause you further problems. Treatment options are worksite changes, changing position of your computer keyboard and making other ergonomic changes can ease symptoms. Exercise, stretching and straightening exercise can help in people whose symptoms have gotten better. These exercises must be supervised by a physician or occupational therapist. Splinting your hand, this helps keep your wrist from moving and also eases compression of the nerves inside the tunnel. Medication, these may be oral or injected into the carpal tunnel space. These reduces swelling. And surgery, this eases compression of the nerve in the carpal tunnel. The longer you have CTS, more damage is going to happen to the median nerve. To ease the pain, keep your arm warm, you can gently hang your wrist on the side of the bed when sleeping. If your doctor allows you, you may do some wrist exercise at home. Wear wrist splints at night. This takes pressure off your median nerve. So, can this be cured or prevented? Yes, it can be cured and prevented. Keeping your wrist straight when using tools, taking frequent rest breaks from repetitive activities, doing stretching exercises before and after activities, monitoring properly, treating medical conditions linked to the carpal tunnel syndrome. Who are some famous people with CTS? Dave Mustaine, he was diagnosed with carpal tunnel syndrome after sleeping on his arm. Matthew Perry is an avid gamer, just like any gamer who puts in hundreds of hours with their favorite game, increases their chance of getting CTS because of pressure.